Professor John Myburgh, Professor of Intensive Care Medicine at St George's Clinical School University. You've just finished your presentation on resuscitation fluids, the intersection of dogma and evidence. Tell us some of the points of that presentation.
Well, it was really a summary of a long journey that I've been involved with in both clinically and in research over the last 25 years. But the story goes back a lot further than that, when the first fluids were given to patients in the cholera pandemics in the 1830s. And really, this iconic intervention in our practice, whilst it's been widely used, has never been fully evaluated in terms of safety and efficacy. And so what I did today was to give an overview of the history and the results of some key pivotal trials that we have done and are doing, which have really informed clinical practice and provided evidence of some safety and benefits to patients.
Now, I know that you've been involved in fact, you've had extensive experience in adult critical care and trauma for 30 plus years, from South Africa to Australia. How have things changed over those years?
Oh, there have been enormous changes in our practice. The major impacts have been technology. Most of the devices we have now are a lot safer, a lot more advanced. But I think the most important thing is the education and the awareness and the integration of research into clinical practice, where good quality research has really informed clinicians about the best things for their patients. After all, that's what we do. That's why we do it. And I think the interaction of these advances in technology and the outputs of very key, important clinical trials are a very good blend to inform people to do the best by their patients.
Now, over your career, you've been involved in 35 clinical trials. What still excites you about doing the research?
Well, it's a question I get asked a lot. Why do you do research? Well, my own motivation, I do research to create knowledge that helps people. And in many ways, the research that we do is really primarily in the interests of public health. We want to make our knowledge informed so that the patients who we care for are better off as a consequence of that. And that's the reason why I do it. I do research mainly to make sure that what we're doing is the right thing, so the people that we care for are better off.
You've also been published over 200 papers, 25 chapters, 5 major research awards. How do you find the time? What's motivating you still to do that?
Well, I guess it's the question you do. Medicine is a lifelong career. I was privileged. My father was a leading surgeon and an academic. He obviously influenced me. But I think, as I mentioned before, and it's about creating knowledge and learning stuff. I learn every day. It's also about relationships. I work with some fantastic people at the George Institute in Sydney, where I've been working for the last 10 years, which really has facilitated a large number of our clinical trials, fantastic relationships with colleagues in the Institute, the coalface with our nurses and our students, and the patients themselves. And of course, it does provide the opportunity to travel and to meet people overseas. You develop a whole series of networks of similar people around the world who become close friends over many years. And I guess what binds us together, as I've mentioned beforehand, is that we're doing this not for our own glory, but it's to improve public health.
And the sharing of knowledge, as you say, amongst colleagues. Are you enjoying the ASM this year here in Auckland?
Yeah, it's always great to come back to the ASM. I haven't been for a while, so this is good to be back at the College ASM. And Auckland's a wonderful city, and it's nice to be here. And so, yeah, what can I say?
All right, Professor John Myburgh, thank you very much for talking to us. Enjoy the rest of your time here in Auckland.
Thank you very much. You're welcome.